Hi everyone! I'm here! I'm a fourth-year medical student at a university, and today we're going to be talking about brain tumors. In this video, I will go over the top 3 most common types of brain tumors. And if you stay till the end, I will share with you one rare type of brain tumor that actually happened to my grandfather. So let's get right into it. The 3 most common types of brain tumors are meningiomas, pituitary adenomas, and all of these are benign tumors, which means that they are meningiomas, making up 16% of all primary brain tumors, meaning that they occur in the brain itself. These are tumors that arise from the meninges, which is the covering of the brain and the spinal cord. They are usually slow-growing tumors, and they tend to affect adults more than children. The most common symptoms would be seizures, headaches, and then also focal neurological signs depending on where the tumor is located. So for example, if it is in the area of the brain that controls movement, then the patient may have weakness on one side of the body. But if it causes compression of the optic nerve, it can cause vision problems. The next most common type of brain tumor is a pituitary adenoma. This makes up about 10% of all brain tumors. Pituitary adenomas are tumors that arise from the pituitary gland, which is a small gland at the base of the brain that produces several important hormones. These hormones include growth hormone, thyroid-stimulating hormone, adrenal follicle-stimulating hormone, luteinizing hormone, and also prolactin. The problem with these hormones is that when there is a pituitary adenoma, there is either an excess or a deficiency of these hormones. So for example, if there is an excess of growth hormone, this can lead to gigantism in children or acromegaly in adults, whereas if there is a deficiency of anti-thyroid stimulating hormone, this can lead to hypothyroidism. And lastly, if there is an excess of prolactin, this can cause problems with fertility or also problems with menstrual cycles in women. And sometimes there may not be any symptoms at all, and the tumor may only be discovered incidentally on an MRI scan of the brain. And the last type of tumor I want to talk about is this is the most common type of malignant or cancerous brain tumor in children. It makes up about 20% of all childhood brain tumors. It arises in the cerebellum, which is at the back part of the brain, and it tends to spread throughout the whole brain. The main treatment for glioblastoma is surgery, radiation, therapy, and also chemotherapy. And the survival rate for children who have this tumor is about 70 to 90%. Now that we've gone over the 3 most common types of brain tumors, I'm going to talk about one rare type of brain tumor that actually affected my grandfather. My grandfather had a meningioma, which was not the typical type that you see most commonly. His was actually called a Somamedes meningioma. This type of meningioma is very rare, making up only 3% of all meningiomas, and this type tends to affect older people like my grandfather. He was 78 years old, and also, this type of tumor has a more worrisome histological appearance under the microscope, but it is still a benign tumor. So, the good news is that it is not cancerous. However, because of his age, he was not able to undergo surgery. And so he received radiation therapy. Unfortunately, the tumor came back a year later, and then he received more radiation therapy. And this time, it did not come back. All right, everyone, that is all I have for you today. I hope that you enjoyed this video and learned something new. If you do have any questions, please leave them in the comment section down below. And if you haven't already, please click the subscribe button so you don't miss out on future videos. And lastly, thank you so much to all my supporters for your generous support. All right, everyone, take care, and I'll see you next time.